Drug testing in sports. When students have completed this content, they should be able to describe how drug education programs in sport developed and the evolution of modern drug testing policies. Define the role of the athletic trainer in the specimen collection protocol. Outline the steps in the chain of custody of a sample specimen. Describe the consequences of a positive drug test through various sport governing bodies. And develop strategies for counseling an athlete about the unintended consequences of drug and supplement use in athletics. Drug education. An overarching goal of sport governing bodies is to provide drug education seminars, lectures, and structured presentations pertaining to substance abuse. For example, in professional basketball, all first-year players participate in a rookie transition program that includes a drug prevention component. Likewise, the National Collegiate Athletic Association, or NCAA, is committed to the prevention of drug and alcohol abuse and deems student-athlete education as a best practice, providing resources that its member institutions can use as needed. The general component of drug prevention recommendation by the NCAA includes the following: establishing a written policy, securing student-athlete written consent before drug testing, defining banned substances and the consequences of a positive test, reviewing the rules of the institution and conference, recommending that all rules be presented annually at the start of each competitive season and as needed with the mid-year transfers, and establishing defined punishments for positive drug tests. Drug education programs historically have focused more on the negative effects of drugs than on how to change athletes' attitudes and behaviors in relation to drug use. Typical programs include both an education and a rehabilitation component. Many individuals believe testing is a necessary deterrent to drug use. Athletic trainers should use as many high-quality resources as available to provide drug education to athletes of all levels. Educational components available to athletic trainers include printed materials such as infographics and posters pertaining to banned drugs that could be strategically placed in common team areas. An excellent resource is a video from the NCAA that details the nature of banned substances, the testing protocol, and the penalties associated with these substances. The evolution of drug testing in sports. The International Association of Athletic Federation, the IAAF, relied on the honor system of athletes pledging that they were drug-free. By the mid-20th century, athletes were doping with stimulants and anabolic steroids in order to run faster, throw farther, and jump higher. During the 1960 Olympic race, a cyclist collapsed and died shortly after. During the autopsy, amphetamines were discovered and identified as the cause of death. The 1960s experienced a proliferation of anabolic steroids in track and field, which prompted the European Athletic Federation to establish drug testing protocols. The International Olympic Committee, or IOC, introduced drug testing for the 1968 Winter and Summer Olympic Games, but the tests had poor analytical capability and did little to deter drug use. Drug screening by individual college athletic programs dates back to the mid-1980s. Athletic trainers were perceived as serving as the first line of detection for this type of program, as a result of their proximity to the student athletes, as well as their frequent interactions with the medical community, coaches, and administrators. A 1984 survey conducted by the National Athletic Trainers Association Drug Education Committee identified 21 schools with a drug testing program, and 9 schools acknowledged conducting the testing on site. An on-site testing system was often conducted by the athletic training staff in the athletic training facility. By 1985, the NCAA drug testing survey indicated that an additional 43 schools had some form of screening program. At that time, the following significant concerns were expressed to the NATA Board of Directors. A philosophical perception that drug testing of student athletes is discriminatory. The potential conflict of interest that could compromise an athlete's health and well-being. Questions regarding the vetting and approval of the testing program by the institutional, medical, and legal representatives. Concerns about the athletic trainer's role on imposing or enforcing sanctions for a positive test. Questions of maintaining confidentiality of testing results, and a general lack of the education and qualifications that an athletic trainer may have to properly assess the needs of an athlete with a substance abuse issue. The World Anti-Doping Agency, or WADA, was organized in 1999 following an IOC conference on doping. In 2004, WADA developed its code, which includes the following standards for organizing these areas: testing, laboratories, therapeutic use exemption, prohibited substances, methods, protection of personal information, and signatories to the code. The United States Anti-Doping Agency, or USADA, signed on to this code. These standards have been adopted by the NCAA and various professional team organizations. They include substances that are banned year-round, for competition only, and for select sports. Various individual institutions and multiple professional sports leagues currently partner with Drug-Free Sport to conduct their testing, in part because of its mission with working exclusively with athletes. Their comprehensive approach determines the following: who is to be tested, how the specimen is collected, and where the specimen is to be shipped for laboratory analysis. The athlete's rights and consent. The development of drug screening and testing programs generated diverse opinions within the athletic training community, with some athletic trainers advocating for testing and others questioning the athletic trainer's role in these programs. The legality of these programs was also controversial within general society. In 1994, a challenge by Stanford University student athletes to their drug testing programs reached the California Supreme Court. In 1995, the U.S. Supreme Court heard the case of an Oregon high school's drug testing program. In both cases, the drug testing was ruled constitutional. Professional athletes have a collective bargaining agreement with their governing body that incorporates their approval for testing. Intercollegiate student athletes in an NCAA institution must grant consent to be tested as part of their participation in the university's athletic program. According to NCAA regulation, each student athlete is mandated to give annual consent to drug testing, and failure to do so at an appropriate time will result in the student being declared ineligible for participation. The responsibility of sport participation. One of the most important things an athletic trainer must consider is that the athlete alone is responsible for the drugs or supplements that they ingest, inject, apply, or otherwise administer. It may be easy to presume that a product is safe from doping because it is purchased at a franchise nutritional supplement outlet, or it is marketed as being all natural. Unlike the process for prescription medication, nutritional supplement manufacturers are not required to meet the same rigorous FDA standards for product safety. Studies have revealed that a high percentage of products have been contaminated with a variety of substances. The FDA acknowledges that it is not authorized to review dietary supplement products for safety and effectiveness before a product is marketed. Competitive athletes subjected to testing must exercise the utmost caution when selecting supplements. Reliable sources exist for determining whether a product runs the risk of yielding a positive drug test. The NCAA publishes a list of banned substances based on the categories noted. The NCAA publishes a list of banned substances annually. Athletes should not rely on this list to rule out any label ingredients. Conversely, the NCAA does not publish a list of approved supplements or drugs. Other important resources for the athletic trainer are the National Center for Drug-Free Sport and the NSF International. The National Sanitation Foundation, or NSF International, is an organization that develops public health standards and provides certifications that help protect food, water, and consumer products and the environment. This is a program that certifies the accuracy of product ingredients. It verifies products do not contain banned substances. Drug-Free Sports Access Program is another resource for evaluating the ingredients of a product. This is ideal for risk assessment. The NSF International Certified for Sports program helps athletes make safer decisions when choosing sports supplements. Several high-level sport governing bodies allow only products that are approved by certified for sport to be recommended or provided to the athletes. Products with NSF certification are recognized by several sporting agencies, including the NFL, Major League Baseball, Professional Golf Association, Ladies PGA, and the Canadian Centre for Ethics in Sports. Some manufacturers rely on a certificate of analysis of a drug or formulation document, which provides the exact details relating to the quality control and specifications of the product. These are based on a sample from which the specific batch and the material from which it was manufactured. The Drug-Free Sport Access Program is an online portal available to athletes or administrators through a subscription service. An athlete can forward information regarding a specific supplement or a drug to the Access portal. Within a few days, Drug-Free Sport will reply to the athletic trainer with information on the presence or absence of a banned substance in that supplement. Individual supplement labels are reviewed by the Drug-Free Sport for the most accurate information. Thus, an athlete can use this feedback as a risk assessment to make an informed decision as possible regarding a specific supplement. Drug-Free Sport regularly acknowledges that their information on medication or supplements testing does not guarantee that it's safe. Despite their best effort, there is always a risk of the presence of an unreported banned substance. The drug testing process. Typically, a drug testing session can be scheduled with Drug-Free Sport by the institution or by the governing body during an athlete's competitive season or in the off-season. Drug-Free Sport furnishes the name of the athlete to be tested on the scheduled day to the institution or the team, which is then responsible for contacting the athlete. Once the testing is scheduled, Drug-Free Sport assigns a trained doping control officer to the screening site, which can be on a college campus, an event venue, or an athlete's home. The National Center for Drug-Free Sport identifies approved laboratories for analysis and provides a consistent drug testing program. This organization is an unbiased and free of conflict of interest with the institution or athlete involved in the screening. Selection for drug testing is random unless a specific athlete requires a follow-up test. Many individual institutions follow the same template or philosophy. Current drug testing techniques offer many advantages but some limitations. For example, urine specimens are relatively easy to obtain and are cost-effective. However, the presence of a witness during urine collection can be considered intrusive. Blood, hair, saliva, and sweat have also been used as drug testing specimens in various settings, and each technique has its advantages and its drawbacks. It is likely that mass drug screenings conducted by the NCAA and U.S. professional sports leagues will continue to use urine specimen samples. General urinalysis detection times include amphetamines and methamphetamines, can last for 2 to 4 days. Cocaine lasts 1 to 3 days. Cannabis, 1 to 3 days for casual use, but can be up to 30 days for chronic use. Opioids, 2 to 4 days, and anabolic steroids, 3 to 4 days. Periureus is an unintended challenge to the specimen collection. The discomfort of being witnessed during drug testing collection can affect the process. Periureus is the functional inability to urinate in the presence of others. It has been called a shy bladder or a bashful bladder. Research has indicated that 3.8% of soldiers required to submit for drug testing have periuresis. The Diagnostic and Statistical Manual of Mental Health Disorders, or DSM-5, classifies periuresis as a social anxiety disorder. Others consider periuresis distinct from social anxiety disorder because it is a condition in which normal physiological function is impaired without a physical cause. Periuresis has been associated with symptoms such as anxiety, depression, and poor quality of life. In early drug screening programs, some intercollegiate athletic trainers conduct a point-of-care test in their athletic training facility. These tests are subjected to many variables and unreliable, which prompted the recommendation that athletic trainers use an outside source and limit their involvement in collecting or packaging of specimens. Current recommendations are that drug testing in the United States should be conducted by Drug-Free Sport or a WADA-approved laboratory for international competition. There are 32 WADA-approved laboratories across the world, including locations in Africa, the Americas, Asia, Europe, and Oceania, with U.S. laboratories in Los Angeles, California, and Salt Lake City, Utah. Although athletic trainers are not responsible for analyzing specimens for banned substances, they should have a general understanding of the testing techniques. The enzyme multiplied immunoassay technique, or EMIT, is an immunoassay testing modality that is generally used to screen for a sample of a specimen. The EMIT test employs visible spectroscopy to measure the presence of certain chemicals or molecules in a substance by evaluating the interaction of those chemicals with specific antibodies or antigens. A positive result from an EMIT test indicates that the test subject has been exposed to the tested drugs, but does not indicate the exact measure of the drugs in the athlete's system. A key component of the philosophy of drug testing is to maintain the integrity of the game. Despite this objective, inevitably, some athletes attempt to beat the system. A positive test can damage an athlete's reputation or have serious financial implications. It can be very tempting to cheat to pass a drug test when the likelihood of failing is significant. One common method of cheating is masking the banned substance with another drug to manipulate the results. A more advanced approach to this method is opting for designer drugs that may be undetectable. A masking agent can reduce renal and urinary excretion of steroid conjunctates, decrease urine concentrate, or possibly inhibit endogenous steroid synthesis. Although masking agents are banned, they have no direct performance-enhancing capacity. Athletes who modify drug tests take the risk that they might still fail the test and face penalties for violating the testing policy. Commercial products are available with specific instructions and claims of detoxifying the system to prevent a positive drug test. One mechanical device is called the Whizzinator, uses a prosthetic penis with a storage reservoir for borrowed urine. The device also mimics natural urination and has a heating element to establish normal specimen temperature. Athletic trainers involved with drug testing should be aware of schemes athletes use to cheat during the drug testing process. A therapeutic use exemption is allowed for banned medication that is prescribed to an athlete by a physician. In this case, documentation is necessary relative to the athlete's history, up-to-date diagnosis, and medication dosage. This is particularly true if the athlete is diagnosed with attention deficit hyperactivity disorder, ADHD, and treated with a restricted use medication such as Adderall or Ritalin. A therapeutic use exemption acknowledges that some banned substances have a legitimate medical purpose. One example is testosterone for the patient with testicular failure. Granting this exemption would be based on the following conditions. The athlete's health would be impaired if the banned drug was withheld. The drug is not likely to enhance the athlete's performance. No reasonable or viable alternative to the banned drug exists, and the necessity of using the prohibited substance is not secondary to any prior use. Of note, there is no exemption for testosterone being given for female athletes because the FDA approves testosterone only for men. However, WADA grants a testosterone therapeutic use exemption to female-to-male transgender athletes who require androgens. Testosterone is generally administered via intramuscular or topical routes at doses consistent with androgen-deficient men, as per the prescribing endocrinologist. As noted previously, there is a link between poppy seeds and opioids. In tests, commercially available poppy seeds paralleled morphine concentrations that could exceed the threshold for a positive drug test. Results of a study indicated that subjects had positive tests at a 24-hour test and 48-hour intervals. The recommendation is for athletes to avoid foods with poppy seeds during time spans when they could be tested. In summary, nutritional supplements and prescription drug use for performance enhancement has occurred for centuries, leading to the development of drug screening protocols to protect the integrity of competition. Various resources and information outlets can help today's athletes screen their supplements for potentially banned substances. A comprehensive drug screening program includes education, testing, and intervention. A drug testing protocol has many common components and is routinely exercised for intercollegiate, professional, and elite international athletes. Many athletes have invested tremendous time and money in their opportunity for success. Thus, a positive test can detrimentally affect their future. Drug testing has evolved from workplace tests done in the athletic training facility to structured processes managed by trained professionals. The many steps in the process aim to minimize the opportunity of masking banned substances or tampering with the sample. Positive tests generally result in escalating sanctions, which enhance the role of testing as a deterrent. Caution should be exercised in administering medication, since even standard supplements and prescription medication may inadvertently cause a positive test. Finally, athletes are ultimately responsible for what they ingest, inject, apply, or otherwise administer into their body.